Gerard van Grinsven. Nobody can pronounce that. I'm originally from a place called Maastricht in the Netherlands. Worked for the luxury hotel industry, worked for Peninsula, Mandarin Oriental, Ritz-Carlton's, opened 26 Ritz-Carlton hotels worldwide. And then, surprisingly, I was asked to open a brand new hospital, $360 million in Michigan, and came there 3 years prior to the opening and was there for 7 years. Then I became CEO of Cancer Treatment Centers of America. And then a couple of years ago, 2 years ago, I started the Van Grinsven Hospitality Group to bring my expertise in terms of innovation, in terms of leadership, in terms of hospitality, service excellence into healthcare. Because I have proven that if you put the right focus on those elements, your outcomes will significantly be impacted. And moved the corporate offices from Chicago to Boca Raton, and that's where I am at the moment.
Thank you very much, Gerard. You brought this vision, this different thinking into this total different sector. Actually, I wanted to say this hotel behind me, but this hospital behind me in a total different sector. So from hospitality into healthcare.
You know, as I told you, I was brought up in the luxury hotel industry. You learn a lot about, how to surprise and delight your customers, how to deliver on the unexpressed wishes and needs of your customers. The CEO of Henry Ford Health System, her name is Nancy Schlichting. She offered me the position of president and CEO of a brand new hospital, which wasn't built yet, with zero healthcare experience. So you can probably imagine how this was being received by the medical world. They didn't like the idea at all. So once I came on board, I had 3 years prior to the opening. And after 2 weeks, I had my first meeting with all the physician leaders of Henry Ford Health System. Henry Ford Health System is a $6.4 billion company in revenue, has 6 hospitals, 23 medical centers, so it's a big system. So the meeting was at 6:30 in the morning, and I came in and I said, ladies and gentlemen, thank you so much for your warm welcome and making me feel comfortable, even though I knew they were not supporting me. And my first statement to them was, I want to be the Cirque du Soleil of healthcare. So you could see their eyes getting big, and I could see in their eyes, CEO gone wild. But I did, at the same moment, I all gave them a copy of a book, and that book is my Bible. And that book is called Blue Ocean Strategies. And in that book, it says that many organizations in different industries all are in the red ocean, meaning they kind of do the same like everybody else. They sometimes package it differently. They put some lipstick maybe on it. But if you really scratch the surface, it's just like everybody else. And what happens is the value for the customer is not increasing. Actually, it's decreasing, but cost keeps creeping up. So there is no value proposition for the customers anymore. Hence, it's very throat-cutting competition. Hence the word red ocean. And in this book, it says, you got to position yourself in the blue ocean and become so distinct, so unique, that you make your competitors irrelevant. So Cirque du Soleil is a typical example of a typical blue ocean strategy thinking company. And this to me was really so compelling that I decided I need to make sure that I don't open a hospital like everybody else does. I need to make sure that I'm going to be so distinct, so unique, that I will make my competitors irrelevant. 6 years later, I beat every outcome you can imagine. I had the highest patient engagement scores in the country, in the US. I had the lowest length of stay. I had the lowest turnover. I had, which by the way, in healthcare means you save a lot of money. I had the highest employee engagement scores in the country, not just in healthcare, but in the entire service industry. I was 18 months ahead of being cash flow positive, and I was 2 years ahead of beating budget. So how did we do it? I first had to get the buy-in of the physicians. And once they read the book, they came back to me 3 weeks later. They said, you know what you are preaching actually makes sense. We don't 100% believe in it, but we will give you the benefit of the doubt. That's all I needed to hear. So what did we do? For instance, I asked the question, we are in a community which is predominantly Jewish, predominantly Chaldean, which is the Catholic Iraqis, upcoming Asian community, and an upcoming African-American community. And I said, I need to know what are the unexpressed wishes and needs of those customers. And then the second thing I said, I want to do and focus everything I do on women, because research has shown that 90% of the decision-making, the purchasing power in healthcare is done by women. So I asked my marketing gurus, I said, how do I know what a Jewish woman wants? And by the way, how do I know the difference between a 60-year-old Jewish woman and a 30-year-old Jewish woman? Same for the Chaldean women, same for the African-American women, same for the Asian women. And the answer I got was, well, let's do a focus group. Well, focus group don't work for me. Focus groups are not really giving you what you need. The only thing they will tell you is probably what you like to hear. They might sometimes even tell you their expressed wishes and needs, but they never will tell you their unexpressed wishes and needs. I said, well, I want you to get me the following. I said, I want you to buy me a pair of silk pajamas, because I want to go and live with these people. I want to go and eat with them. I want to see how they pray. I want to see what they discuss over the dinner table. I want to see what's important in their culture. In the pre-opening, 6 months religiously, 4 nights a week, I went to Jewish homes, Chaldean homes, African-American homes, Asian homes. I brought with me food. Why food? Because when you break bread with somebody, the relationship changes, and people will tell you things they will never tell you in a meeting room with a flip chart. With that, I became the most popular guy in the community. Every night I went somewhere, it wasn't just the family who lived there. They also invited their uncles, their aunties, their nephews, their cousins. And in that, they started to really express to me what really they value most. So I did that for 6 months. Because of that, I made 72 design changes in the hospital because of that feedback. Because of that, I had to go to the board and ask for $45 million more investment. But I got approval in the board after 5 minutes. Why? Because I showed that all my improvements would significantly improve the cash flow performance of our hospital. And by the way, this hospital is not a private hospital. It's a not-for-profit hospital. So we just get reimbursed like everybody else. So with that $45 million, I made significant design changes. So to give you an example, one of the feedbacks I got was that in our traditional designs of our emergency room, we have a standard design with a curtain, and that's the standard design for an emergency room. But what the Chaldean culture was telling me, when one of us goes to the emergency room, we all want to be there. We all want to be there to provide support. So we actually enlarged the emergency rooms, and we also put sliding doors there so that other people wouldn't hear, the distress they were under, etc. Anyway, then also I created a whole cultural onboarding so that my people who was coming on board would really understand from each different culture what really was important to them when they would come to the hospital. So I did that. Secondly, women told me that women are not just interested in getting traditional medical care. They also want to participate in activities and programs which will help them in their physical and mental well-being. So I started to say we should move totally away from being a hospital. And I said we are going to be a community center for well-being, where foremost it's all about great clinical care, it's all about patient safety. But why can't we at the same time also become health coaches and health mentors to the communities we serve? And I got a tremendous pushback on that from the physician world. Oh, Mr. van Grinsven, you don't understand. We are here to treat sick people. We are here to fix sick people. Sick people. I said, no, you're not. We are here to create a journey of wellness, not a journey of illness. Because in my humble opinion, healthcare has moved too much to sick care, and it's not anymore embracing the word health. It's all about sick care. And I wanted to get away with that in the blue ocean thinking to create a community center for well-being rather than a typical hospital. So now when you walked into my hospital, my lobby, it didn't look like a hospital, it didn't feel like a hospital, it didn't smell like a hospital. It felt like a beautiful nature mall type of environment where instantly people felt at ease, where instantly people could sense my journey of wellness, of well-being is starting here, not my journey of illness. So at the entrance, I created the following. First impressions are very important to me because when you make a great first impression, it impacts the entire stay of a customer. So at that entrance, we had a dog, a beautiful black Labrador dog. He was called Henry, and he was just there to give our customers a warm welcome. After 3 months, we had 6 Henrys walking through the hospitals because patients, the staff loved it, and it put people at ease. It reduced their stress levels. Secondly, when you walked in, you would see right away an incredible wellness spa called Vita. And why that? Because right above it, we had our women's health department where women would go for cold clinical mammograms. And I said, I don't want them to just go for a cold clinical mammogram. I want them to come for a wellness visit. So after their mammogram, they would go to the spa, the wellness spa, and meet with their health coach. But that was not good enough. Right next to it, again, don't forget, first impression at the entrance, I created a 100-seat auditorium with a state-of-the-art kitchen line because food to me is medicine. Food to me is healing. And I said, why can't we create a food delivery where food actually will be tasty, it will be healthy, it will be fresh, it will be organic, and it actually will help healing our customers? Because I wanted to have a cuisine which really would help bringing more the focus on wellness to the table. And here you see a picture of that kitchen auditorium. So this we promoted to the local community. So people with diabetes, heart conditions, people with cancers, people like you and I who want to stay healthy. We basically helped people to come and learn that food actually is healing and food is actually medicine. So because of that, the local community was coming to a hospital which normally they never would set food in unless they would be ill. So I changed the whole paradigm of what the hospital was about. Guess what happened? My restaurant became Restaurant of the Year in Detroit. People in the community just came to my hospital to just eat breakfast, lunch, dinner, to have meetings there, because we took this scary hospital feeling away and we made it feel like a community center. So people felt I can go there and really learn how to stay healthy. So, but that was not good enough. I had an atrium, a huge big atrium. So I decided that every weekend I wanted to do concerts there. So the Detroit Symphony Orchestra came and did concerts there. I had every Sunday a jazz concert, 600 people in the community would come. And with those concerts and with those cooking classes, I also was smart enough to have cameras that they could be listened to and followed by the patients in their patient rooms. You probably think I'm crazy, but I decided to do weddings in my hospital. The whole nursing staff, the physician staff was in uproar. How on earth can you do a wedding in our hospital? Well, first of all, the design didn't look like a hospital. You saw the pictures. Secondly, why not? Why not creating activities around the patients that they feel, hey, I'm still part of the community? But guess what happened to the patients? The patients who could overlook the wedding from their patient rooms, they started to ask the nurses, can you put my bed closer to the window? Patients who were able to walk were standing on the balustrades looking down because it lifted up their spirits and it actually helped them in their healing. So now, instead of a cold clinical experience, now it is a wellness experience, and society is still surrounding me. I still see activity, and that helped them in their healing. So then we said, studies show that private rooms actually significantly reduce infection rates, and also it helps the healing of the patient. So I insisted that we had private rooms, no semi-private rooms. Now, that was a difficult decision because as I am a not-for-profit hospital, I only would get reimbursed for a semi-private room, not for a private room. But I felt if I can significantly reduce infection rates, if I can enhance the experience for the patients and their family members to be so superior, then that would reduce length of stay. That would reduce readmission rates, which would save us a lot of money. And that is exactly what we did. So we had private rooms. Then I asked questions like the following. I said, why do we wake up patients in the middle of the night to draw blood? And they told me, well, that's our protocol and that's what we do. And I said, but do we do that for the betterment of the patient, or is it really for our benefit? And what I found out, it was for our benefit. So I decided that we're not going to wake up patients in the middle of the night to draw their blood unless clinically needed. Guess what started to happen? Patients started to sleep longer. Studies have shown when patients sleep better, they heal faster. Therefore, length of stay goes down. Therefore, you save cost. But I did that because that was the right thing to do. That made us distinct. This made us unique, and it impacted our outcomes. I also was very much aware that you can't create that experience blueprint if you don't have the right culture in your organization. And in healthcare in the US, I don't know how it is in your countries, but healthcare workers are not emotionally engaged. They are overworked, they are tired, they don't feel they're being valued, they don't feel that they are really being treated in the right fashion. You have to understand, if you don't have highly emotional engaged workers, studies have shown that that leads to miscommunication. Miscommunication leads to medical errors and therefore leads to unnecessary death. So for me, outside of all that other innovative stuff, for me, it was very important that I also created the right culture. And what I did, I decided to become a talent-based organization, meaning I would not recruit based on skill set and experience. I would first look at natural talent. I would want to know for every single employee who came to work here, including physicians, including surgeons, I wanted to know what are their natural talents. Because in healthcare, you want to have people who have a natural talent for relationships. You want to have a natural talent for compassionate care. But often we hire warm bodies, We put them at a reception desk in a hospital or in a medical center. They have no talent for relationships, no talent for compassion care, and that becomes your first impression when you go and see a doctor. And that's not what I wanted. So hiring based on natural talents became number one focus for me. Then I looked at the skill set and experience, so I could put people on the right seat on the bus with the natural talents they had. And then once they were sitting on the right seat on the bus, then I wanted to make sure I unleashed them. So that meant that I had to set a very clear vision for the hospital. I then had to inspire my people around that vision so they were getting excited about it. And then, because I put them on the right seat on the bus with the talents they have, then I should unleash them and not micromanage them and not dictate to them what they can and what they cannot do, but unleash them so that they could utilize their talents to the fullest. And therefore, I was creating a culture of highly emotional engaged employees who felt valued, who felt their opinion counts, who felt I can make a difference, who felt ownership. And because of that, they started to highly emotionally engage with the patients, the customers, the family members. And the problem in healthcare, and I don't know how it is in Roche, but you have a bunch of leaders sitting in a boardroom making all the decisions. But these people hardly have a clue what's going on in the organization or hardly know a customer. And if you have a highly emotional engaged workforce, which is being unleashed, then they feel safe to come up with innovative ideas. And you as a leader will benefit from that. And studies, research is proving that when you have a highly emotional engaged workforce, your innovation ideas triple. So that's the culture I created at Henry Ford West Bloomfield. So my message to you is, when you become the blue ocean focused Roche, make sure that you also create the right culture which can support that blue ocean thinking. So to give you an idea, from a leadership perspective, every morning when I came to work, I would have my cup of coffee, and then I told my assistant, Mary, I'm going on a walkabout. So as the CEO of 1,900 employees, I went for 3.5 hours every day, religiously. I walked through my hospital. I shook hands and kissed babies. I went to the patient floors. I went to surgery. I went to the lab. I went to the emergency room. I went everywhere. Why? Because I wanted to know, the staff to know who I am and that I'm just one of them. I'm a servant leader to them. And they were completely blown away because in their history, they never knew who the CEO was. They never knew what he stood for. And then every day I went to speak to patients. Remember what I was doing. I was setting the example. I was walking the talk. I was saying, this is what I believe is important. And therefore, my leaders did exactly the same. Every week, I had on Tuesday afternoon tea with GVG, Gerard van Grinsven. And I would sit in the atrium, this big atrium, and people could just come and have a cup of tea with me. It was not mandatory, but people loved it because I was accessible. I was normal. I was one of them. And therefore, what did they do? They started to open up to me. They started to ask me, we need help here or there. They came up with innovative ideas, which I rewarded. And that's why we had those extraordinary outcomes. The last innovative idea I'm going to share with you is the following. In healthcare, we do an employee engagement survey once a year, if you're lucky, twice a year. And then, everybody gets excited and has to fill in these forms. And then at the end, what happens with those results? Nothing. They end up on the shelf. So I said, how can I feel the finger on the pulse in how my workforce feels? Do they feel engaged? Do they feel valued? So I came up with the following. You know how people swipe in and swipe out before they go to work? Well, I created the GVG, Gerard van Grinsven, engageometer. And what it was a very simple stoplight, red, yellow, and green. And then every day there was, when they swipe out, there was a question, and they had to tell me how emotionally engaged did they feel today, how valued did they feel today. And they just had to touch red, yellow, and green. That's all they had to do. So now every week, I got a whole report with color codes. Where did we had some engagement issues in the hospital? And of course, I focus on the yellow ones and the red ones. And so within a week, one of my leaders would have to call the leader of that department and say, what's going on? Let's dig into it. When there were issues, I could resolve them quickly, and I didn't have to wait for a year to get the results of that. And then last but not least, in the patient rooms, after the first day, the patients would get a little simple survey on their TV where they had to click yes or no. And if people were not satisfied after the first day, 6 of our leaders, including me, would get an instant text message on our phones. And I insisted that within half an hour, somebody would be in that patient rooms to figure out why were you not satisfied? What can we do to turn things around for you? The patient loved it. The family members loved it. That's why I also had the highest patient engagement scores in the country. So how does this all apply to Roche? Well, it really does apply to you, because you are a great company. You have a great brand. You have a great reputation. But with like every great brand, often we start falling asleep at the steering wheel because we believe we're doing things right. Everything is going well. Why should we change? And I hope that this story helps you maybe to say, well, wait a minute, should we become the blue ocean of the pharmacy world? Should we create something distinct and uniquely which none of our competitors are creating? Can we create a new reinvigorated culture whereby really our people now are going to triple our innovation ideas? So I'm not telling you what to do, because you are the experts in your own field, but I believe that my message and that my learnings are adaptable to any industry, any company which is in the service industry. And I hope that this story somehow, makes you think a little bit about what could you do differently as you continue leading your organization.
Remy.
Thank you. And then Gerard, I have a very basic question for you. You were at the beginning of your story, you were approaching the fact that you got approached twice, basically, by some of your customers while you were in the hospitality industry, and so they could probably foresee this blue ocean area that you were thinking of in you. And I was wondering, what do you think make them already think like that at the moment? Because if they were at the origin, so they were probably very visionary to already think through that like that. And I was just wondering, what's your perspective on that? And if you could double click on that experience.
Yeah, so Nancy Slichting, the CEO of Henry Ford Health System, decided to approach me and try to engage me because she knew that this new hospital, she had one chance to make it a success. She also knew that this was in a very competitive environment, and she was worried if she was going to bring in a traditional healthcare leader, that she would just get the same old, and she wouldn't be able to make a difference financially and from a clinical perspective in the community we serve. I was at that moment, I was in Dearborn, Michigan, which is a neighborhood of Detroit. And I did a significant project there with Ritz-Carlton. I created the Reborn program because this was one of our worst performing hotels in the company. And I proved that with a very innovative new approach that you could actually reinstill, again, incredible faith in the culture there, but also reinstill faith in the community. And I think she probably saw what I did with that underperforming project and thought maybe that's the type of leader I want to bring to healthcare. And I think that probably instigated her to approach me.
First of all, thank you very much. Truly inspired and fascinating story. And I'm just wondering, because you're talking about highly regulated and traditional market and industry in a way. And I'm just thinking about the leadership style that you somehow engaged with and work with, because eventually you're talking about people that, you know, are very professional and it considered to be an area where the clinical expertise and the traditional ways of thinking is the right way to do that. And then how did you, or thinking about an organization like Roche or any other pharma organization that is working in traditional way, where do you see the starting point of using these leadership capabilities or the ways of thinking to shift the culture and to enable this way of thinking that eventually will enable these innovative ways of working and then eventually really provide the value for the customer?
Great question. I mean, as you know, I was in a very regulated industry, the healthcare industry in the United States. But I decided that I wasn't going to pay attention to that. I had one opportunity to really create a new experience blueprint. And I wasn't going to let the regulations stop me from doing what was right for the patients, what was right for the community, what was right for my stakeholders. So I made that from the beginning crystal clear that if there were regulatory things which would hold me back to do certain things, then we were going to find ways to overcome those regulatory issues. But I didn't focus on that. I let my experts, my people, find ways to overcome that. Because in the beginning, in the first couple of months, everybody was telling me, well, you can't do that. That's not what we do in healthcare. And that's not, you don't get approval on that. And it's regulations say X. But I didn't want to have handcuffs. So I said, no, I'm here for the patient. I'm here for my customer. And we're going to do whatever it takes to bring value to the customer. And then it's up to you experts to find ways how to overcome the regulatory issues which we have to overcome. Certain things I couldn't do because of regulations and I gave in, but we were able to change a lot of things. So how do you do that in a highly regulated arena like yours? It starts with leadership, because if the leader is not clear in his or her vision, if the leader isn't willing to really become the role model in walking that vision, if the leader is not willing to inspire the workforce to get on board with that vision, then it never, ever will get to where you need to be. And so why our hospital was successful, because I was allowed by my leader, Nancy, to be unleashed. So it takes guts in a highly regulated environment to think blue ocean. It takes commitment to see the vision through. It takes inspiration to inspire people to let go of what they are used to. And I can tell you, in the beginning, the physicians were very against all my ideas. The regulatory people were throwing all kinds of excuses at me why things couldn't be done. But because I believed in the vision and because I was committed, I said, no, we will deliver on this, because my number one customer is my patient. And I need to stand up for that patient. And one of my strongest talents is relationships. I'm in the business of relationships, because if you have relationship with your politicians, with your regulatory people, with your community, with your physicians, with your staff members, guess what? People start to give you the benefit of the doubt, and people are more willing to work with you. So this is a very long answer to your question, but it can be done if the vision is there and if the leader is willing to push it through.
I've got a question for you. I'm going to go out on a limb here, so my Roche colleagues will doubtless correct me. Let's assume there's 100,000 people working at Roche overall across all the divisions. I would hazard a guess that about 1% of them have regular contact with patients. Patients, not doctors, but patients. And I really love the fact that you talked about emotional connection. Now, I can see that if you have direct contact with a patient, you're going to feel that immediate emotional connection. What about the 99,000 who don't? How would you make that link between emotional connection and then establish the other corresponding links to innovation and freedom of thinking and what have you?
It starts at the top. When I came, I had a board, and my board of directors, we had every month a board meeting. And I asked the board members, when was the last time you met with a patient? And they looked at me and said, what do you mean? I said, well, you should really get to know the patient. And by the way, you really should get to know our employees. When was the last time you spent time with an employee? And I knew the answer, 0. So I set up that 3 times a year, the board members would, for an entire day, would walk, and it was all structured, walk through the hospitals, talking to patients, talking to employees, and really getting a good feel of what they had to deal with. That led me to start the board meetings to invite a patient to every board meeting. So we would start the board meeting with the story of the patient. And we encourage the patient to tell us the good, the bad, and the ugly. And to really tell the story through the eyes and ears of the patient, the family members. Often they brought their family with them. This was very powerful because now the board member heard it from the customer, him or herself. Then I did the same with all levels in the organizations of those people who don't have that emotional connectivity with the customer. So I made sure that they got roundings in the hospital so that they could see the work they do behind the scenes, how advantageous that actually can be for the patient. And also for them to actually see the patient, talk to the patient, and for the patient to see, hey, this person is working towards my well-being behind the scenes, even though I never get to see him. So I broke a lot of pillars, which was established. I broke a lot of silos, and I created this whole open culture where everybody at the level, starting with the board, and then to all levels, got much more exposed and therefore could create pride and joy in what they're doing. I mean, think about the pharmacy who were downstairs on the lower level, no windows in their offices, constantly under stress. They didn't feel, the touch of how they emotionally engaged the patients until the time we brought them to the patients, and they could see that their work is so essential in the overall well-being of the customer. So again, it's a cultural thing you have to create that engagement.
I have one question that is really intriguing me. You were the leading man behind that change. You were defining the vision, you were role modeling it for several months, so people were following you. But you also touched on the point that at a certain moment within the organization, people started to do innovation, which is something that we try to nurture within Roche. I'm keen to learn from you how you did that and what your observations are, what needs to be in place that the people themselves are starting to do innovation and sometimes even disruptive innovation. What is the condition that you need to create to make that happen?
Yeah, a great question. Because with an inspirational leader like me, who really walked the talk and is the role model, I also had to be very careful. Well, what about if I leave? Is everything collapsing then? Or do we have an infrastructure in place where this continues regardless whether I'm there or not? And I decided to embrace here in the US, it's called the Malcolm Baldrige quality criteria. The Malcolm Baldrige National Quality Award is the highest award you can get in the US. It's given out by the President of the United States of America. And what it is, it's about really giving recognition to those organizations who build criteria, build an infrastructure where innovation continuously happens. So the award is very much around innovation. It's a very difficult award to achieve. And I was the lucky man to get this award at the Ritz-Carlton. And I also got it at Henry Ford because of Henry Ford West Bloomfield Hospital. So it wasn't about getting the award, but it was very much about the criteria the Malcolm Baldrige National Quality Award embeds for organizations to embrace, which creates that infrastructure that automatically the right focuses on processes is done, the right focus on innovation is done, the right focus on the customer is done. And what I did in the pre-opening, I embedded those criteria in the design of my hospital, the infrastructure design, the process design, so that it was now a system which was in place, which would continue to function regardless whether I was there or somebody else was there. So the system automatically kept the focus on the right elements, on the right customer value proposition, and to do it through the right processes, which would lead to also this innovative environment where innovation would be continuous. So that was one, which is very important, and that's something I will continue using wherever I go. Secondly, I really created a competition within the hospital that, you know, people were rewarded for bringing innovative ideas to the tables. And with that would be significant awards of monetary level, but also award of paying people to go back to school, paying special education courses, et cetera, and we had a quality innovation council who would then evaluate all the quality awards and would then, you know, come up with the top 5 prize winners. And this would always be done in this big atrium, and it would be done with great food and with great fanfare and great press attendance. And that again created, you know, the workforce to continuously think about, well, maybe we can do something differently, which will enhance the value proposition for the customer.
Thank you so much.
You're welcome.
Thank you very much. Thank you very much for being with us, and
It was a pleasure.
looking forward
you,
to
Gerard.
meeting you again. Thank you.
Thank you, Niels and Gerald. Bye-bye.